you're told that your type 2 diabetes is a lifelong condition, something you'll need to manage with medication forever. Then you discover that there's a way to potentially reverse it. No gimmicks, no shortcuts, just by changing the way you eat. In this video, we're going to reveal how the ketogenic diet is not just another trend, but a scientifically backed approach that has the power to radically transform your health and help you break free from the cycle of insulin dependency and high blood sugar. As you probably already know, type 2 diabetes is a chronic condition that affects the way your body metabolizes sugar or glucose, which is your body's primary source of fuel. In a healthy body, the hormone insulin helps transport glucose from your bloodstream into your cells, where it can be used for energy. But in type 2 diabetes, your body either resists the effects of insulin or doesn't produce enough insulin to maintain normal glucose levels. This leads to elevated blood sugar, which can cause serious health problems over time, such as heart disease, kidney damage, nerve damage, and more. So, what exactly is the ketogenic diet and how does it work? The ketogenic diet, or keto for short, is a low-carb, high-fat diet that has been around for nearly a century. The main idea behind keto is to drastically reduce your carbohydrate intake and replace it with fat. By doing this, your body enters a state called ketosis. In ketosis, your body becomes incredibly efficient at burning fat for energy instead of glucose. Ketosis also turns fat into ketones in the liver, which can supply energy for the brain. The typical keto diet consists of about 70 to 80% fat, 10 to 20% protein, and just 5 to 10% carbohydrates. This macronutrient ratio is designed to keep your body in ketosis, where it burns fat instead of carbs. But how does this relate to type 2 diabetes? The link between the ketogenic diet and type 2 diabetes lies primarily in insulin. As we mentioned earlier, insulin resistance is a hallmark of type 2 diabetes. When you eat carbohydrates, they're broken down into glucose, which spikes your blood sugar levels. In response, your pancreas releases insulin to help your cells absorb the glucose. However, when you eat a high-carb diet over time, your body can become resistant to insulin, meaning your cells don't respond to it effectively. This leads to high blood sugar levels and eventually type 2 diabetes. The ketogenic diet may help by reducing the amount of glucose in your bloodstream. When you limit carbs, you lower the amount of glucose that enters your body, which reduces the need for insulin. Over time, this can lead to lower blood sugar levels and improved insulin sensitivity. Some studies have even shown that people following a ketogenic diet can reduce or eliminate their need for diabetes medication. Let's dive into one of the most groundbreaking studies on the ketogenic diet and type 2 diabetes, the Virta Health study. This multi-year clinical trial was designed to see if a keto diet could help people with type 2 diabetes manage or even reverse their condition. The study involved over 300 adults, all of whom had type 2 diabetes and were on various medications, including insulin. The participants were divided into two groups. One followed a standard care plan, while the other group adopted a strict ketogenic diet, consuming less than 30 grams of carbs per day. The keto group also received continuous remote support from a team of healthcare professionals. Now, here's where it gets really interesting. After just 1 year, over 60% of the people on keto were able to reduce or completely eliminate their insulin use. In fact, 94% of them reduced or got off their diabetes medications altogether. Their HbA1c levels, a key marker of blood sugar control, dropped significantly, with many reaching levels that are no longer in the diabetic range. These results weren't just short-term. Even after 2 years, most participants maintained their lower medication use, improved blood sugar control, and significant weight loss, around 12% of their body weight on average. These real-life results in this study showcase the power of the ketogenic diet, which, especially when combined with continuous care, can be a powerful tool for not just managing, but potentially reversing type 2 diabetes. It's a game changer for anyone looking to take control of their health and reduce dependency on medications like insulin. And it's not just about managing symptoms, it's about addressing the root cause of insulin resistance and high blood sugar by fundamentally changing the way your body processes energy. But before you jump into keto, there are some important things you need to know. First, while keto can be highly effective, it's not a one-size-fits-all solution. The ketogenic diet is a significant lifestyle change, and it requires careful planning and monitoring, especially if you're managing a condition like type 2 diabetes. If you're considering keto to manage or reverse type 2 diabetes, it's crucial to work closely with your healthcare provider. They can help you monitor your blood sugar levels and adjust your medications as needed. Going keto can lead to drastic changes in your blood sugar, and your medication doses may need to be reduced or even eliminated as you progress. The ketogenic diet is generally safe for most people, but it can have some side effects, especially in the early stages. These can include what's commonly known as the keto flu, which includes symptoms like headache, fatigue, dizziness, nausea, and irritability. These symptoms usually subside within a few days to a week as your body adjusts to burning fat for fuel. It's also important to stay hydrated and ensure you're getting enough electrolytes, as keto can lead to dehydration and electrolyte imbalances. The keto diet limits many types of fruits, vegetables, and grains, which can lead to deficiencies in essential nutrients like fiber, vitamins, and minerals. To avoid this, it's important to focus on nutrient-dense, low-carb foods and consider supplements if necessary. Eating a variety of non-starchy vegetables, nuts, seeds, and healthy fats can help you get the nutrients you need while staying in ketosis. Keto can be challenging to maintain over the long term. It's a restrictive diet, and some people find it difficult to stick with, especially in social situations or when dining out. Before starting keto, consider whether it's a diet you can realistically maintain and think about how you'll handle potential challenges. While keto has been shown to be effective in the short to medium term, the long-term effects are still not fully understood. More research is needed to determine whether keto is a sustainable and healthy way to manage type 2 diabetes over the course of many years. It's important to weigh the potential benefits and risks and to stay informed about new research as it emerges. So, can keto reverse type 2 diabetes? The answer is that it certainly has the potential to do so for many people. The ketogenic diet can be a powerful tool for lowering blood sugar levels, improving insulin sensitivity, and even reducing or eliminating the need for diabetes medications. However, it's important to approach keto with caution, do your research, and work closely with your healthcare provider to ensure it's the right choice for you. If you found this video helpful, please give it a thumbs up and consider subscribing for more content on health, nutrition, and wellness. And if you've tried keto or have a success story of your own, we'd love to hear about it in the comments below. Also, if you liked this video, this one will blow your mind.